based off of the picture that you have painted today, do you feel that it is fair to say that we're looking at a picture of Dr. Habib Davanloo that is quite complex? We have a masterful clinician on the one side, but on the other side, we have a person who is quite complex and who has difficulties interpersonally.
Yeah, absolutely right. Very capable, but at the same time, at some level, he's tortured.
The first thing I heard you say was that he challenged you right out of the gate.
Right,
The second thing I heard you say is that he was very focused on your strengths and helping you realize your strengths.
right, right.
And the only reason that that was effective is because he established himself as credible and trustworthy.
Absolutely. That is the key.
Yeah. And then the last thing that I heard you say was that he helped you with perspective taking. In other words, picture your mom a block away.
Right.
Okay. So those are the components that I'm hearing. Oh, and then the last one was, and it's part of perspective taking, but it's and looking at your strengths, but it's seeing yourself as a mountain climber and that you basically have what it takes. Am I right about that?
Absolutely.
And so in the initial session, when you said that he challenged everything you said, can you elaborate on that so I can get a clear picture?
Yeah, I don't remember exactly what that conversation was initially, but anytime I said something that wasn't clear or definitive, he
Mhm.
would challenge it. He was
Mm.
challenging. What did you mean by that? Or
Mm.
is that what you really meant? So,
Mm.
I mean, he behaved in a manner that was totally unexpected by
Mm.
me,
Mm.
having been exposed to psychiatrists in medical school
Mhm.
who usually just listened or made inane comments
Mhm.
or what have you.
And how did that affect you? How did that make you feel in the session? Now, what about this idea that when people think about Davinloo's work and when they think about ISTDP, it's primarily about helping people get in touch with their feelings and work through their feelings, and yet that is not the picture that you have given me. Can you say something about that?
Um, no, I don't. I cannot make that connection.
So you mean when you and Davinloo worked on you facing the painful truth, it was facing how painful your life has been and how hard you've worked
Right.
and how many sacrifices you've made. Is that accurate?
Correct. Yes.
So here I am with Hyman Rabinovitch. And Hyman, please tell me about yourself and your relationship to Dr. Habib Davanloo.
Okay. Let's start back in October 1978.
Hmm.
And the place is Montreal, Quebec in Canada.
Hmm.
And I was born and grew up in Montreal, increasingly unhappy with the political and the language issues in the province.
Hmm.
I don't know how up you are on that situation, but basically, Quebec is essentially a French province where, for the last 30 years or so, the political movement was more towards the French suppressing the English
Hmm.
from language and everything else. So I was very uncomfortable living in Montreal.
Hmm.
And a job opportunity became available in Philadelphia, and I accepted it. It
Hmm.
was a good job. I accepted it. And so I quit my job in Montreal, sold my home, and prepared to move with my wife and three young sons
Hmm.
to another city in another country where I knew no one.
Hmm.
Now, if this move had proven to be a mistake, I would be in serious difficulty
Hmm.
as my financial safety net was very thin to
Hmm.
non existent.
Hmm.
My level anxiety over this whole issue was over the moon.
Mm-hmm.
It was as if I had a message tattooed to my forehead that read, "Help, I'm in pain." I couldn't see it, but everybody else could. Well, one day my wife came to me and said, "You need to see a psychiatrist." To which I replied, "No way." I was exposed to psychiatry in medical school, and those practitioners were not only ineffectual, but some of them appeared to need more help than the patients they were treating. And she said, no, I have a very good friend who's a social worker at the Montreal General Hospital, and there's a psychiatrist there who is truly sensational. He developed a new form of therapy called intensive short-term dynamic psychotherapy, which is very effective and short-term, and you should give him a try. And so I agreed I'll see him once for my evaluation of him. Anyway, I met with him. He was a short, heavy-set Iranian who spoke with a heavy accent. And within 15 minutes, he had me reeling as he challenged everything I said. I realized immediately this guy was different. He didn't just sit there and listen. I saw him once a week for 10 weeks. And in that time, he cured me. And I use cure, which is a word that you seldom, if ever, hear in mental health care. Not only of the problem I went to see him with, but several other issues that came up in our 2.5 months of therapy.
And what year was this, Hyman? What year was this?
This was in October to December 1978.
And tell me more about this initial session.
Okay, well, just let me finish, and we can come back and touch on details of the initial session, or I can go back to that part of it. But basically, he convinced me after he found out more about me that I was very efficient and could accomplish a great deal, because in fact I worked myself through undergraduate 4 years at McGill for a science degree and 4 years at the University of Toronto for a medical degree. And he convinced me that I was very capable and that I certainly would be able to manage my move down to Philadelphia. Now, one of the other things that came up that is very, very impressive was that I had, prior to seeing him, a profound fear of flying. Okay, I was terrified of flying. I wouldn't go to medical meetings because it required an airplane flight. And he cured me of my fear of flying in 3 sentences. So it even impressed him. Okay. Now, incidentally, the move to Philadelphia proved to be a win-win-win situation across the board. I ended up with a better job, a better home, better school for my boys, and better work opportunities for my wife, who's an architect who develops real estate. Now, one of the other things that came up in the course of therapy was how annoyed I was, how painful it was to me to hear my mother talk to me as if I was a child. And she would say things like, "Dress warmly, it's cold outside." Now, at the time, I was a pediatric surgeon with a family, and this was not appropriate, and it bothered me. And what he said was, you're hearing her as you did when you were a child living together in the same home. And that is what is bothering you. Just think of her as talking to you, not in the same room, but she's a block away when she's talking to you. That was an instant cure from then on.
That was the cure. Was that the cure of the fear of flying or the annoyance with your mother?
Both. They're both separate incidents that all came up in the 2.5 months I saw him.
Oh, I see. But what were the 3 words that cured your fear of flying?
3 sentences, actually. Again, I would see my life as climbing a mountain. And this is what saw me through 4 years of undergraduate and 4 years of medical school. And I could only look to a short distance to the next step, wouldn't dare look to the top or the bottom of what I was climbing. And what he would say, what he said was, but you are an expert mountain climber. You have proven yourself accomplishing what you did in spite of your lack of funds. You're an expert mountain climber, and even expert mountain climbers will sometimes slip, but they have a safety rope that will keep them from falling to the bottom. They recover and they get back up to the top. And so that was a real eye opener to her, to it all. Now, another thing that came up was that I'd had a serious fight with my father. And later that week, he was walking down a staircase when he happened to have the shoe on his other foot untied, stepped on the shoelace, fell down the stairs, hit his head, and died. And Davinloo said to me, you know, in psychiatry, if you wish somebody dead and he dies, then it's as if you killed him. Well, later that day, I saw patients in the office, and a mother came to me with her daughter because of bedwetting. And my thought was, I just killed my father, and you're concerned about your fucking daughter wetting the bed. Anyway, the end of 1978 happens to be the time of the Iranian hostage crisis. Knowing he was Iranian, I questioned him about his family back in Iran and what were his thoughts on the whole situation and so on. And his response was zero. It's as if I hadn't said anything. And he was very careful not to reveal anything about his personal life. He was there just to talk about me and my life. And this is all part of establishing a therapeutic alliance, which I feel is absolutely crucial in developing a trust in everything he says. The same thing said by somebody else would have had no effect whatsoever. But coming from him, it was very powerful. And we see that to some extent when people go to India to meet with a guru. Okay. And they listen to the guru and they trust the guru. And it's very, very effective. Now, interestingly, I mentioned that to somebody, this Jewish man, who said, you know, wise old religious leaders can sometimes have the same effect, where the person talking to them just believes everything they say and as the absolute truth, when the same thing, exactly the same thing said by somebody else would have no effect. So that is very crucial. Now, what happened when I finished therapy, and I had to finish because I was leaving for Philadelphia, all of a sudden, he became my friend. on the very last session, he became my friend, changed completely, 180-degree turn, and he presented me with 3 of his books that were personally autographed to me. That was, I don't know, there was something in me that touched him. In 2005, he invited me to one of his international conferences, which was held in Varde, Denmark. And to help me in defraying the cost of getting there, he sent me a check for $5,000.
Oh, my goodness.
I mean, yeah, this was the level of his commitment to me. Anyway, I got there and I looked at the program and I was absolutely shocked to see that I was included in the speakers panel. I was a patient, I'm not a therapist. I'm a pediatric surgeon, not a psychologist or psychiatrist. Anyway, I did speak mainly about myself and my issues and my relationship to Dr. Davinloo. And after my presentation, one of the attendees came up to me and said, I wish you had more time to speak. I really enjoyed what you had to say. And one of the Danish psychiatrists on the program, he was scheduled to deliver a half-hour talk, came to me and offered me his speaking slot, which again came out of the blue. Anyway, this was a 3-day meeting. And at the farewell dinner at the end of the conference, I was talking to Davinloo, and he wouldn't talk to me. And I pleaded with him, please tell me, what did I say or what did I do that was wrong or bad? And he would not respond. As a matter of fact, when I got back to Philadelphia, I phoned him in Montreal, again, pleading for a reason. And he would not give it to me. Now, all I can conclude was that he felt I detracted from him. Now, that's like an elephant being threatened by a mouse. I mean, how can I detract from him? But I think it's a measure of his insecurity. And then a number of years later, he was having another one of his international conferences in Montreal, and he invited me to come there. This time, I had a series of slides and presented 4 or 5 slides setting forth my interpretation of the cause of neurosis and its treatment by intensive short-term dynamic psychotherapy. Now, after the presentation, a number of attendees came up to me and requested copies of my slides. Now, after I got back to Philadelphia, I got a phone call from Nancy, Davinloo's daughter, who asked for copies of my slides. Now, I cannot imagine she wanted the copies. I can only surmise that her father asked to get copies as well. Now, in early 1980, I was in Philadelphia, and Davinloo came down from Montreal to deliver a talk at the Albert Einstein Medical Center. And there were about 200 attendees there, psychiatrists, psychologists, social workers, mental health nurses, and so on. And he presented a series of videotaped cases of successful treatment. Very, very impressive. When he got all through, he opened the floor from questions. And there followed an inordinate period of silence. Nobody said anything. It seemed like an eternity. And finally, a psychiatrist got up and said, if I spoke to my patients the way you speak to yours, they would leave me and never return. To which Davinloo said, I have never lost a patient. But it was interesting that he presented this very impressive talk that even if you knew nothing about psychotherapy, you would have to be impressed. And yet, I don't know how many of the 200 were impressed. Now, at one point, I suggested to Davinloo that his therapy is so monumental and effective, and neurosis is so common that I felt he was worthy of a Nobel Prize. Now, he didn't respond, so I can't tell if he agreed or he didn't. Now, you cannot recommend somebody for a Nobel Prize. The Nobel Prize committee have to make up their own mind. But I wrote a letter to them, not suggesting that Davinloo get a Nobel Prize, but just suggesting that they look him up and look into what he's doing and what he's achieved, and then make a determination about the Nobel Prize. Well, it's not surprising. I never got a reply from them.
Wow. This is incredible what you're sharing. Would it be okay if I ask you some follow-up questions, or is there more you want to get out before I do?
Yeah, there's a bit more, and then we can turn it over to you. Now, from time to time, I run into mental health care workers, psychiatrists, psychologists, social workers, and I find that most of them have either never heard of intensive short-term dynamic psychotherapy, or if they have, they know very little about it. And when I suggest that at least 1/3 of talk therapies, and as you know, there are many talk therapies out there, are totally ineffectual, and a lot of the others are at best only somewhat helpful, and none of them cured. On the other hand, ISTDP is potentially capable of a cure, as I saw very, very personally in at least 3 instances. And the cure of fear of flying, I know I have, after that, flown all over the world, visited 50 countries, flown in small airplanes. I even took a flight from Paris to Moscow on Aeroflot. So that's really something.
Yeah, no doubt. It sure is.
Now, the training of ISTDP is laborious and lengthy. And one of the problems is there are very few therapists around, because I mentioned it to somebody here in Boca Raton, and he was interested and he looked into it. And the closest therapist was 500 miles away in North Florida. Now, also, there's an enormous commitment in treating a patient by ISTDP, in that you have to pay a lot of attention to what the patient is saying and what he looks like and what he's doing and so on. And I imagine you can't help but become very emotionally involved in the patient's trauma. Now, I may be wrong, but it would appear to me that the burnout rate of ISTDP therapists is high, which is true.
I think there's something to what you're saying. Yeah, I'm not sure, but I think so.
I mean, John Fredericks, I don't know how old he is, but he's retired now, and yet he's very effective and just gave it all up.
I did not know that. That's news to me. Goodness. I have so many questions. Is this the right time or not quite yet?
No, not quite yet. Almost. Now they're talking about ineffectual and lengthy psychotherapy. This is a true story. A psychiatrist who's now deceased, but he practiced Freudian psychoanalysis. And he very proudly announced that he was celebrating a 50th anniversary of a patient of his.
Hmm.
Now, he probably saw the patient more than once a week. I think Freud saw his patients 4 or 5 times a week. And I mean, that speaks volumes. One patient a number of times a week for 50 years, and he was proud of that. He shouldn't have been proud. He should have been ashamed. Anyway, the final thing I spoke to you about the last time we spoke about Davinloo not being invited to his one of his patients' weddings. I can repeat it for the recording, or not.
Yeah, no, go ahead. Go right ahead and repeat it, please.
Yeah. Okay. Well, one day Davinloo was very upset because he had a patient with very severe depression who was suicidal, a youngish man in his early 40s. And Davinloo was able to cure him. He then learned that this young man had recently gotten married, and he was very distressed because after saving his life, he was not invited to the wedding. So you have to think of Davinloo, who was the master of psychotherapy and knew so much about neurosis and mental illness, and he was not aware of the stigma of mental illness. And there is a real stigma. And I think the stigma relates to the fact that the general public are well informed about physical health. They know all about cancer and diabetes and all sorts of things, but they know virtually nothing about mental health. And Davinloo couldn't see the consequences of him at the wedding being introduced to the groom's family and that of his new wife. If he was a cardiologist, he would have been invited. But it was interesting that he didn't see that.
Yeah, I see what you mean by that.
Yeah. Anyway, I'm very impressed with ISTDP. It's short period of time of treatment and its effectiveness, but I would call it psychosurgery without anesthesia. It can be very painful, and the therapist, of course, backs off if he touches on something that's so painful that it may incite other issues, so on.
Wow. Oh, this is quite an exposition. Thank you very, very much. Hyman, what I'm thinking is that in about 15 minutes, I have to go. I'm wondering if we could pivot and I could begin to ask you some questions. Would that be okay?
Yes, fine.
Okay. And then also in the interest of time, if you could, just try to be as concise as possible because I want to get to various things here, if that's okay with you.
Okay. Yeah, fine.
Okay. So the first question is this, that did Davinloo ever let on in any way that he understood at some level that he had been jerking you around, giving you the cold shoulder in one moment and then inviting you for another conference the next moment? Did he ever acknowledge that he had been jerking you around?
Not at all. Now, there are 2 phases. One, in the 2.5 months I was a patient. And then there was no question. He was not going to open up personally.
Right.
And then following that, when we were friends, in quotation marks, it never came up. I never questioned him, as to why he behaved the way he did when I was in therapy. But I understand its importance in developing this therapeutic alliance. Now, I get some people on Quora, which I was on, talking about their therapist and how close they are and how much they know about their therapist and how important it is to know. Not at all. If you have a surgeon, you don't have to know about the surgeon's personal life, how many children he has, how well he gets along with his wife or any of those things.
Mm.
You want your surgeon to take care of you, cure you, and say thank you. Come back to see me if you need to.
Mm.
Uh,
Mm. Okay, that's helpful. Thank you for that. The other thing, again, pivoting to what you spoke about earlier about the treatment itself. So, if I heard you correctly, you mentioned three things that seemed very significant in your healing. The first thing I heard you say was that he challenged you right out of the gate.
right,
The second thing I heard you say is that he was very focused on your strengths and helping you realize your strengths.
right, right.
And the only reason that that was effective is because he established himself as credible and trustworthy.
Absolutely. That is the key.
Yeah. And then the last thing that I heard you say was that he helped you with perspective taking. In other words, picture your mom a block away.
Right.
Okay. So those are the components that I'm hearing. Oh, and then the last one was, and it's part of perspective taking, but it's and looking at your strengths, but it's seeing yourself as a mountain climber and that you basically have what it takes. Am I right about that?
Absolutely. In
Oh,
other words, he convinced me that I should not have a problem with this move. And
mm,
coming from someone who had developed this therapeutic alliance, I believed him.
mm-hmm,
If anybody else, a neighbor, a friend, a relative, who said to me, "You're very capable, you'll be fine,"
mm-hmm.
I would it would not be effective.
Right,
But coming
right.
from him, it was very effective.
Yeah, no, that's clear. I hear that loud and clear. Now, what about this idea that when people think about Davinloo's work and when they think about ISTDP, it's primarily about helping people get in touch with their feelings and work through their feelings, and yet that is not the picture that you have given me. Can you say something about that?
Um, no, I don't. I cannot make that connection. My feeling was when I came to see him, I was terrified. I, about what might happen if this move didn't work out and it was a mistake. And he reassured me that it wasn't a mistake because I was very capable and I would be able to handle it and adjust.
Right,
I
right.
was capable, I was trained, I was experienced. I had worked for 11 years at the Montreal Children's Hospital, and I was going down to Philadelphia to do the same thing. So it should have been obvious to me, but it wasn't because of all the unknowns.
Right.
And he
So,
made it clear that there is nothing new down there. Children in Philadelphia are just like children in Montreal, and they get the same illnesses and they respond the same way to your surgery and your treatments.
right. But just a moment, just in the interest of time. So I understand that he emphasized your strengths. I understand that he relied on logic and reasoning. But for instance, when you brought up your annoyance towards your mother, is it true? Am I hearing you correctly that he did not actually encourage you to feel that annoyance towards your mother more deeply? Is that true?
No, no, not at all. All he did was say, when you hear her speak, she's
Mm-hmm.
not speaking to you as a child.
Mm-hmm.
You should hear her speak to you as an adult, which
Mm.
will only be possible if you imagine her talking to you from a block away. So you're not together in a room as you were when she was speaking to you as a child.
Yeah. And what do you make of this? What do you make of the way he worked with you and how different that is from how most people understand ISTDP? And I'm sure what was in your own presentation when you presented slides yourself. What do you make of this major discrepancy?
Uh, I'm not quite sure what the question was.
No,
Uh,
the question is when we think about ISTDP and Davinloo's work, it's all about helping people face intense rage and guilt and grief and love and tender feelings and all the rest of it. But that's not what you're describing in your treatment. What do you make of that?
Well, unfortunately, we don't have the video, or I would show you my slides that I have put together as my interpretation of the cause of neurosis and its treatment and cure by ISTDP. And basically, what I have is the unconscious consisting of the painful truth and the truth that is not painful from earlier years. And I have a blackberry representing the painful truth, which I have named truth, TROOTH. Now, also, I didn't intend on bringing this up, but when I went to the meeting in Montreal and I showed a slide with the BlackBerry label truth, everybody there had heard Davinloo talk about the truth as a painful truth, but did not give me credit for it. But when they saw me talking about it and showing it on a slide, Davinloo admitted that I was the originator of that work.
Oh my. And that's something else. But Hyman, in your case, in your treatment, what was the painful truth that you faced?
The painful truth was what I had to do to get to where I was. I mean, for 8 years, I worked every day, not when I was at school, but the day school finished, I was working the next day. At the end of the summer, I worked until the day before I went back to school. And it was a sacrifice, but I knew that my exit from poverty was through education. And I would do whatever it took to get out of the poverty. And it worked.
So you mean, just a moment. So you mean when you and Davinloo worked on you facing the painful truth, it was facing how painful your life has been and how hard you've worked and how many sacrifices you've made. Is that accurate?
Correct. Yes.
Oh, I see.
Because the initial encounter with him was all about my struggle to get through 8 years of university. And I earned all the money that it took to get through, and had a cousin who helped me financially. And in the 8 years, he had loaned me a total of $600, which I repaid him. Now, $600 for 8 years of university is not very much.
Right. I see. And so in the initial session, when you said that he challenged everything you said, can you elaborate on that so I can get a clear picture?
Yeah, I don't remember exactly what that conversation was initially, but anytime I said something that wasn't clear or definitive, he would challenge it. He was challenging. What did you mean by that? Or is that what you really meant? So I mean, he behaved in a manner that was totally unexpected by me, having been exposed to psychiatrists in medical school, who usually just listened or made inane comments or what have you.
And how did that affect you? How did that make you feel in the session?
Well, it was all part of his developing this therapeutic alliance that gave me confidence in saying this guy is for real. I mean, he was very, very effective. Now, I have a picture here of Davinloo and myself in 2005, which I would have shared with you if we were able.
Can you email it to me? Would you be willing to email it to me?
Yeah, I can take a photograph of it and email it to you.
Please
Okay.
do. Please do.
Is Davinloo still alive? Do you know?
He passed away, I believe, at the end of 2023. Don't quote me on that,
Oh,
but I believe so.
oh, really? Okay.
Or
No,
2024, one of those years.
because I saw him about 6 or 7 years ago,
Mm,
and he was very frail, and
mm,
I believe he was 94 at the time.
mm,
So he was well on in years. But
mhm.
yeah,
The last thing, Hyman, that I will ask you to elaborate on, and then unfortunately I have to get going with my day, but
sure.
the last thing is say a little more, elaborate a little bit on this transition from being your clinician to becoming friends. Was there a long period of time that went by before he initiated the friendship, or was it right after the treatment ended? Tell us more.
It was the 10th session
Hmm.
in the 2.5 month period, and it came to me like a bolt out of the blue.
Mm,
Because when it was all over, and he
mm,
knew I wouldn't be back because I was leaving for Philadelphia,
mm,
his demeanor, everything about him changed.
mm.
And he sat down with me, having prepared three of his books beforehand, and autographed them right there in front of me and presented it to me.
Right.
So, it was very unlike his relationship with me in the 10 sessions before. And
Yeah.
it came out of the blue. I had no inkling that
Right.
this was coming.
Right. And what was your next point of contact? Was it a week after? Was it a year after? Was it 10 years after? What was the next point of contact?
Well, there was no face to face contact after I left, but there were frequent telephone calls. And sometimes they were quite lengthy. Other times he was busy and they were short. But I would call him from Philadelphia,
Mm,
and I had his private number,
mm,
which I don't imagine he gives out freely. But
hmm.
I had his private number, and sometimes we would have lengthy conversations. Now, at one point, he said to me that the pharmaceutical industry is against him. They don't like him. I presume because ISTDP does not use medication, and the
Mm,
pharmaceutical industry make billions on medication for anxiety and depression and so on. And I regret not having asked him, in what way did the pharmaceutical companies go after you?
mm,
Now, the other thing he mentioned was that he did a presentation at the American Psychiatric Association meeting,
hmm.
which I presume was very large. And I know what these American Medical Association meetings are like. And he made this presentation with his usual video content, and they never followed up with him. Nobody questioned him. Nobody asked him to tell them more about his treatment or anything. And he sounded as if he was disappointed. Like, it was as if I spoke to him in a foreign language and they didn't follow anything I said.
Mm, mm,
Um, I didn't. I didn't know that he presented ISTDP at the American Psychiatric Association.
mm,
But my experience with him at Albert Einstein Medical Center in Philadelphia, I
mm,
guess, was after speaking for an hour, there wasn't a question, nothing. It seemed like it was 10 minutes before anybody spoke up. It was
mm,
actually no more than a minute or two. And
mm,
all this psychiatrist could say is, I couldn't talk to my patients the way you talk to yours.
mm.
So interesting.
Yeah, that was a bit of a blow to his ego then.
Yes.
Hmm.
Yeah.
Hmm.
Yeah.
Hyman, did you ever have mixed emotions about how things played out in terms of a friendship forming after the treatment? Did you ever have mixed emotions about that?
No. Well, I was obviously shaken up when, after the meeting in Denmark, when he refused to talk to me and refused to tell me why he didn't talk to me. I was hurt because I had enormous respect for him, and I'd like at least to know what I said that offended him. But obviously, I did. And the only thing I can come up with is the fact that my presentation was very well received. I mean, the fact that a Danish psychiatrist who was scheduled to speak said to me, you take my half hour and you deliver a talk.
Yeah.
Like,
Yeah.
sort of hard to believe.
Yeah. Now, Hyman, let me ask you, based off of the picture that you have painted today, do you feel that it is fair to say that we're looking at a picture of Dr. Habib Davanloo that is quite complex? We have a masterful clinician on the one side, but on the other side, we have a person who is quite complex and who has difficulties interpersonally.
Yeah, absolutely right. Very capable, but at the same time, at some level, he's tortured. He would ask me repeatedly about my thoughts about some of the people that went up to Montreal to train with him, including. It wasn't he that asked; it was his daughter Nancy that would ask, and I can only presume that he would get feedback from her. But there were other people he also asked, what do you think about so and so? So he was not a perfect, happy man. He was tortured, but driven by his need to prove his treatment technique. Absolutely driven. I don't think he made much money in the whole process. But that was not important to him.
Yeah, it's a complex picture of the man, isn't it?
Very complex.
I so appreciate your candor. I'm so grateful that you have shared this experience. And is it safe to assume that you wish for people to know about this, to know your story?
Yes.
And thank you for the time today. Thank you.
Okay. You're very welcome. Okay.
Take care. Yeah, talk to you soon. Okay, bye-bye.
Okay, bye-bye.